How do I understand my COPD blood test results? Imagine trying to piece together a puzzle about your health without all the pieces. Blood tests for chronic obstructive pulmonary disease can give you some of those pieces. They aren't the main way doctors diagnose COPD, but can tell a lot about how your lungs are doing and if there are other issues. To understand your results, you need to know what each test measures and what the numbers mean. One common test looks at markers of inflammation in your blood. COPD often causes your body to have more inflammation, which can be seen in certain ratios. The neutrophil to lymphocyte ratio measures the balance between two types of white blood cells. If this ratio is high, it suggests more inflammation, which can mean more severe COPD or a higher risk of complications. Another ratio, the eosinophil to basophil ratio, can help predict if you might have flare-ups or exacerbations. These ratios help your doctor see how active the inflammation is and guide treatment decisions. Another important test is the arterial blood gas analysis. This test measures the levels of oxygen and carbon dioxide in your blood. If your oxygen levels are low, it means your lungs aren't exchanging gases well, which can happen in advanced COPD. High carbon dioxide levels can also be a sign that your lungs are struggling to remove it from your body. These results help your doctor decide if you need supplemental oxygen or other therapies to support your breathing. Blood tests can also check for a genetic condition called alpha-1 antitrypsin deficiency. This condition can cause COPD even in people who don't smoke or are younger. If your blood shows you have this deficiency, your doctor can suggest specific treatments and recommend testing for family members. Sometimes, doctors order other blood tests to look for infections or heart problems that might be making your symptoms worse. Tests like C-reactive protein or erythrocyte sedimentation rate show if there is ongoing inflammation but aren't specific to COPD. They are part of the bigger picture your doctor uses to understand your health. When your blood test results come back, your doctor will interpret them alongside your lung function tests, like spirometry and imaging scans. Spirometry measures how much air you can blow out and how fast, giving a clear picture of your lung capacity. Blood tests add information about inflammation, gas exchange, and genetic factors that influence your COPD. Regular blood tests can help track how your disease is progressing or how well your treatments are working. If inflammation markers are high, your doctor might adjust your medications or suggest more frequent checkups. Blood gas results are especially important if you need oxygen therapy, helping your healthcare team decide the right flow rate and duration. In the end, understanding your COPD blood test results means knowing what each test shows about your inflammation, oxygen levels, and genetics. These results are pieces of a larger puzzle that includes lung function tests and imaging. Your healthcare provider will explain what your specific numbers mean for your health and what steps to take next. Remember, these tests are tools to help you and your doctor manage your COPD better and keep your breathing as comfortable as possible.